Good afternoon, everyone. Thank you so much for taking the time to join us today. We will be discussing, if we can get our slides, there we go. We will be discussing 4 topics today that will be impacting women's health for Alabama Medicaid recipients over the coming months. And these are the 4 topics that we're going to touch on today. So we're going to talk about changes to the hysterectomy consent form and the administrative review process. We're going to provide an overview of presumptive eligibility for pregnancy. We're going to talk about our maternal hypertension quality improvement project and do a brief overview of the transforming maternal health model. So changes to the hysterectomy consent form and the administrative review process will begin on October 1st of 2025. Federal law requires Alabama Medicaid to receive a completed consent form prior to paying a claim for hysterectomy. And it also outlines the requirements that must be met for Alabama Medicaid to pay a claim for a hysterectomy. Furthermore, Chapter 28 of the Alabama Medicaid Provider Billing Manual, specifically Section 28.6.7, outlines the definition for medical necessity for hysterectomy, defines unusual circumstances for hysterectomies, and outlines the requirements for consent form completion and submission. Upcoming process changes will be reflected in the October 1st, 2025 Provider Billing Manual update. Beginning on October the 1st, 2025, a new hysterectomy consent form will be required for all hysterectomies. This consent form will be posted on the Alabama Medicaid website prior to October 1st in the file path that you will see on the screen. So medicaid.alabama.gov, under Resources, Forms Library, Consent Forms. And this slide presentation will be posted to the website, and the direct link to that page is here in the blue hyperlink on this slide. Alabama Medicaid will allow a 3-month grace period for implementation of the new consent form. However, procedures performed on or after January the 1st of 2026 must utilize the new consent form to prevent claim denials. You'll see on your screen our existing hysterectomy consent form, which is probably familiar to many of you on the call. We're going to outline the changes that will be happening to parts 1, 2, and 3. Parts 4 and 5 will be unchanged on the new consent form. So you can see part 4 outlines unusual circumstances, again, as defined in our provider billing manual. So those conditions, an individual is already sterile, the hysterectomy was performed under a life-threatening situation, or during a period of retroactive Medicaid eligibility. And then part 5 will also remain unchanged. So now we're going to go through the changes to parts 1 through 3. So the change to part 1 is highlighted in yellow on your screen. We have added a statement at the end of the physician certification for medical necessity that states that the procedure is being performed for the treatment of disease and not for the prevention of disease or prophylaxis. This points back to the medical necessity definition that is found in Chapter 28 of the Provider Billing Manual. For Part 2, again, the change in Part 2 highlighted in yellow on your screen. And this involves when an individual would be unable to consent for themselves. And if a representative consents on their behalf, it must be someone who has the legal authority to do so. So if an individual, for example, is not competent to consent for the hysterectomy, which will result in sterilization, the person who signs for them must be legally declared legally eligible to sign for that individual. And this obviously prevents someone from receiving a hysterectomy procedure that will result in sterilization against their will. Part 3, only the title has changed in Part 3. just to reflect the date of surgery. So no other changes there. So the existing process for all hysterectomies as of today is that obviously a consent is obtained and the surgery is performed. The consent form and the medical records are submitted to Alabama Medicaid for administrative review following the completion of the procedure. A medical necessity review is completed for all hysterectomies, and then based on that medical necessity determination, the claim is paid or denied. So this is a post-procedure prepayment medical necessity review at the agency. In an effort to reduce administrative burden for providers and to expedite claims payment, we are modifying the process beginning on October the 1st. So beginning on October the 1st, only procedures that have an unusual circumstance will continue to be processed as they are currently. In the absence of unusual circumstances, only a completed consent form will be required to be submitted to Alabama Medicaid through the provider web portal or via fax, as outlined in Chapter 28. And if the consent form is complete, then the claim will be processed for payment. So beginning October the 1st, 2025, if there are no unusual circumstances present, Alabama Medicaid will no longer require the submission of medical records and will no longer complete a prepayment medical necessity review. If there are unusual circumstances present, the existing process will continue. So consent will be obtained, surgery is performed, consent and medical records are uploaded or faxed, the medical necessity review is completed here at the agency, and then the claim is paid or denied based on that determination. Okay, so to summarize the changes for hysterectomies beginning on October the 1st, beginning October the 1st, that all hysterectomies, regardless of the circumstances, should be using the new hysterectomy consent form. We are giving a 3-month grace period for transition, but after procedures performed on or after January the 1st of 2026, those claims will deny if the old consent form is used. So it's really important for all providers for hysterectomies that you go ahead and implement the new hysterectomy consent form as of October the 1st. For hysterectomies in the absence of unusual circumstances, only the consent form will need to be submitted to Alabama Medicaid for review. And upon receipt of that completed consent form, the claim will be processed for payment. Hysterectomies performed under unusual circumstances will continue to require the submission of both the consent form and the medical records, and will undergo medical necessity review at Alabama Medicaid prior to claims processing. Just a reminder that Alabama Medicaid monitors utilization of all procedures resulting in sterilization and may conduct post-payment medical necessity reviews as needed. All of these changes will be reflected in the October 2025 Provider Billing Manual Update. The new consent form will be posted to the Alabama Medicaid website prior to October the 1st. A provider alert will be issued detailing all of these changes, and provider representatives are available for questions through the Provider Assistance Center at 1-800-688-7989. Okay, we'll go ahead and move on to presumptive eligibility for pregnancy. So Senate Bill 102 was passed by the Alabama legislature during the 2025 legislative session, and that bill became Act 2025-204. This law provides presumptive eligibility to pregnant women for Medicaid prior to Medicaid's approval of an application for Medicaid coverage. And implementation is required by the law by October the 1st of 2025. So the law very specifically defines the presumptive eligibility period, and the presumptive eligibility period will start on the date on which a qualified provider determines, on the basis of preliminary information, that a woman is eligible for Medicaid coverage for pregnancy, and ends on one of the three following options. So it either ends on the date in which the agency makes a determination of eligibility for coverage based on an application filed by the woman. If the woman fails to file an application with the agency for coverage, the last day of the month following the month in which the qualified provider made the determination of presumptive eligibility, and no later than the 60th day after the qualified provider made the determination of presumptive eligibility. So under no circumstances would this benefit be available for more than 60 days, and would generally be available for less than 60 days based on one of the two bullet points mentioned earlier. Medicaid has determined the following entities to be qualified providers who can determine a woman is eligible for presumptive eligibility for pregnancy: hospitals, federally qualified health centers, rural health centers, county health departments, physicians, certified nurse midwives, certified registered nurse practitioners, and physician assistants. Qualified providers may determine a pregnant woman to be presumptively eligible for coverage for ambulatory prenatal care under Medicaid if they determine on the basis of preliminary information that her household income does not exceed the modified adjusted gross income, or MAGI, limit for the eligibility of pregnant women, which is currently in effect under the state Medicaid plan. This information can be found at on the Alabama Medicaid website under Apply for Medicaid, Medicaid for Pregnant Women, Qualifying for Medicaid. And these, the MAGI is adjusted annually, and those new income limits are posted each year to the Alabama Medicaid website. The law requires submission of preliminary information to the qualified provider, which is defined as proof of pregnancy and documentation attesting to monthly household income. Self-attestation is acceptable for proof of pregnancy and monthly household income. The law requires the qualified provider who determines a woman is presumptively eligible for ambulatory prenatal care to notify Medicaid of the determination within 5 working days via the email address that you see on your screen, pep@medicaid.alabama.gov. And they must also inform the patient that she must apply for Medicaid no later than the last day of the following month after eligibility for PEP has been determined. The benefits available to an individual under the PEP benefit plan, again, are defined by federal law. So ambulatory prenatal care is what they are eligible for. Medicaid has designated a benefit plan that covers professional claims. Examples of professional claims would be provider office visit claims, outpatient claims. Some examples of those would be laboratory studies or ultrasounds, and pharmacy claims. Inpatient claims and dental claims are not covered under this benefit plan. So whereas a pregnant woman with full Medicaid has dental benefits throughout the pregnancy and up to 60 days postpartum, women who have PEP, or presumptive eligibility for pregnancy, only have coverage for ambulatory prenatal care and do not receive inpatient or dental benefits. It is for this reason that it's very important that these women apply for full Medicaid as soon as possible so that they have access to the full benefits. Claims submitted under this benefit plan must include a pregnancy diagnosis in order for the claims to be processed for payment. PEP recipients are not assigned to an ACHN, and a referral from the ACHN is not required to provide care for recipients in this benefit plan. However, when they apply for and receive full Medicaid, the normal processes that are currently in place will be required, such as the ACHN assignment and the referral from the ACHN to the maternity care provider. So Medicaid encourages providers to assist patients with submitting full Medicaid applications as soon as possible. And those online applications are available at insurealabama.adph.state.al.us. And for qualified providers to begin participating in determining individuals eligible for PEP, you must complete training provided by Alabama Medicaid. And more information on this training will be available on the Alabama Medicaid Maternity website. You can email any questions that you have about presumptive eligibility for pregnancy to pep@medicaid.alabama.gov. Okay, we're going to briefly touch on 2 additional topics before we move over to a Q&A session. So the next one is going to be a maternal hypertension quality improvement project. So over 20% of Alabama Medicaid maternity recipients have a diagnosis of hypertension. Hypertension and cardiovascular disease are major contributors to maternal mortality in Medicaid maternity recipients. Alabama Medicaid has joined CMS for a maternal hypertension affinity group for 2025 and 2026. The states participating receive technical assistance to improve outcomes related to maternal hypertension. Medicaid created quality improvement projects related to maternal hypertension. They are designed to increase access to remote patient monitoring for individuals with maternal hypertension. Details about our RPM coverage can be found in Chapter 111 of the Provider Billing Manual. Covered diagnoses include maternal hypertension and gestational diabetes, amongst others. So many various entities can refer Alabama Medicaid recipients to remote patient monitoring, but once that referral is placed, the order for remote patient monitoring must come from the primary care provider or maternity care provider. So we wanted to let you all know about this because you may experience an increase in requests for enrollment orders for RPM related to this QIP. I have put my email address here on the screen. If you have any further questions or feedback about this program or anything we can do for you related to this, please let me know at my email address there on the screen. And lastly, last but certainly not least, Alabama Medicaid is very excited that we are one of 15 states to receive the Transforming Maternal Health Model Grant. This grant is from the Centers for Medicare and Medicaid Innovation, and the funding intends to enhance maternal health and birth outcomes for pregnant and postpartum women. Medicaid presented an informational webinar on July the 9th, 2025. The webinar recording and slides can be found at the file path you see on the screen. Newsroom, Special Initiatives, Transforming Maternal Health Model, after going to medicaid.alabama.gov. The team also issued an informational provider alert on June the 18th of 2025, and that can be found under Newsroom Alerts. And any questions that you have after reviewing the materials mentioned here can be directed to the TMA email box at tma@medicaid.alabama.gov. And I'm going to turn it back over to Melanie for moderation of the question and answer session.
Great. Thank you, Dr. Traffanstedt. Appreciate all that information. Please remember to record your attendance today by typing your name and the organization you're with in the chat box. In addition, if you have any questions or comments about any of the information presented today, please enter them in the chat box now. Any questions that we're not able to answer today, we will provide responses on the Medicaid website. And I wanted to give you a path to follow to find that information. When you log on to www.medicaid.alabama.gov, you'll visit the Programs tab and go to the Maternity page. On that Maternity page, you're going to see a recording of today's webinar. You're also going to see slides, and you'll also see an FAQ, or frequently asked questions document. Anything submitted today, questions that we can't answer during the webinar, we're going to need to take back and just confirm details probably with the program areas, and we will provide responses in that FAQ document. So we're going to go on pause just a moment. You're just about 30 seconds of silence while we review the chat and see if there's questions that we can address today. So go ahead and continue to submit your questions to the chat box at this time.
Okay, so a couple of questions that we've received in the chat. One of them is, let's see, prophylactic hysterectomies. So prophylactic hysterectomies are not a covered benefit. Medical necessity for hysterectomy is defined in Chapter 28 of the Provider Billing Manual. And in the past, the process that we were completing here at the agency in performing a medical necessity review would have captured that. But now that is why we have added the additional statement to the physician certification, is because hysterectomies are a covered benefit for the treatment of disease, but not for the prevention of disease or prophylaxis. And that's been a longstanding policy and is described in Chapter 28 of the Provider Billing Manual. We received another question about submission of the consent form, and those processes remain unchanged. So the same process that you are currently using to submit the consent form and the medical records to the agency for review will remain exactly the same as they are now. So you'll submit the consent form only through that exact same process. Okay, I believe there are a couple more questions. Let me see if I can grab those here. Okay. So the question is, if a pregnant woman is awarded PEP and is later determined to be ineligible for full Medicaid, will prenatal visits she had under PEP still be paid? And the answer is yes. So when a woman is determined eligible under PEP, the services, while she is covered under the PEP benefit plan, as long as they are covered services, as mentioned during the presentation, will be paid. And just remember, all claims payment is subject to all of the other requirements that are in the Provider Billing Manual, But just in terms of speaking specifically to PEP, if she is determined to be ineligible for full Medicaid, those claims will still be paid, subject to all of the normal rules and regulations around claims payment. Okay, let's see. What information do we need to include in the email to PEP regarding presumptive eligibility? This will be a part of the training for the qualified providers when they are, so when you go through the training to become a qualified provider or determiner for PEP, all of those questions will be answered in that training. And that training, again, the information about that training is going to be on the Alabama Medicaid Maternity webpage. Okay, when submitting the consent only, will we need to attach the ID? So when submitting the consent only, you will continue to follow all processes as described in Chapter 28 of the Provider Billing Manual. So the submission process is unchanged. So the way that you have been submitting the consent form and the medical records will be the same way that you will submit only the consent form. So no changes to the submission process except for what you are required to submit. We received another question. Will it be the responsibility of the MCP to notify the ACHN when they need a referral? So the current process when a pregnant woman receives full Medicaid, where the woman is assigned to an ACHN and then the ACHN and the woman is given information about the ACHNs, and then the ACHN makes contact with the woman or vice versa, and then the referral is issued. Those processes are also unchanged. So once a woman is granted full Medicaid, the process will work exactly like it does now. So what if the Medicaid application is denied? I believe we've already answered that one. So claims for services under PEP will be paid even if the woman is determined to be ineligible for Medicaid. Just a reminder that when that eligibility determination is made, PEP will end. So PEP ends, you know, when one of those three conditions is met. And the first one of those bullet points in the presentation is when an eligibility determination is made based on the application submitted by the individual. Okay, let's see. Any other questions that you all have seen in the chat that we need to?
Citizens.
If, So a question about will women who already have Medicaid still be covered under PEP once pregnant, or do they just go straight to the ACHN process? Yeah, I'm not sure we understand that question fully. If they already have Medicaid, they would not be covered under PEP. So if they already have full Medicaid, they wouldn't need PEP. So if you have any further clarification you can provide to us on that question, we'll try to answer it further.
You see the last two.
So I am going to defer. There is a question about each individual person having to complete the qualified provider PEP training, or is it for the group as a whole? I'm going to defer that to our beneficiary services team. I believe some of them are on the call. If they're able to answer that, that would be great. And if not, we will put that answer in the frequently asked questions document that will be posted to the website. So the next question is, will the PEP eligibility determination also cover prenatal lab work performed by LabCorp or other outside lab vendor? So if you remember, the PEP benefit plan covers 3 types of claims: professional claims, outpatient claims, and pharmacy claims. And claims for lab work and ultrasound, for example, would fall under outpatient claims. And so those would be a covered benefit under the PEP benefit plan. Yes, so for patients who have coverage based on presumptive eligibility, will it show as full coverage on the web portal, or will there be a different coverage type for PEP eligibility? It is a different coverage type. So it will indicate that they have PEP and not full Medicaid. So another question about prophylactic hysterectomy. Prophylactic hysterectomy is not a covered benefit for Alabama Medicaid as defined in Chapter 28 of the Provider Billing Manual. Thank you. What does PEP stand for? PEP is our acronym for Presumptive Eligibility for Pregnancy. So this is the new benefit plan that is going to be available to women as of October the 1st. So another question about what happens if a recipient delivers while on PEP. Great question. So PEP would not cover the inpatient hospitalization because inpatient claims are not a part of that benefit plan. But there are other possibilities for coverage for that circumstance that could possibly pick up and cover the woman for the inpatient stay. So we'll further answer that question, give an official answer to that question in the frequently asked questions document.
Paul responded.
Okay, so Paul McWhorter from our beneficiary services team that will be training determiners for presumptive eligibility for pregnancy has responded in the chat that the entity, as in the practice, will enroll for the entire group, but each person who will be determining eligibility will also need to enroll individually and receive the training. Okay, well, I think we've answered most of the questions in the chat. We, again, will be posting a frequently asked questions document to the website and provide additional clarification on any that we left outstanding. And I'm going to turn it back over to Melanie.
Thank you, Dr. Traffanstedt. Yes, I do realize there's a couple of more questions in the chat box. We will provide answers to those whenever we have our FAQs or frequently asked questions posted to the website. Again, we're going to have the slides, the recording, and the FAQs posted together in the same section. That's www.medicaid.alabama.gov. Alabama is spelled out. Then you're going to click on the Programs tab, and then you'll select Maternity from the drop-down. When you get to that Maternity page, you're going to see this information, and we're also going to be posting information later this week, possibly next week, on specifics on presumptive eligibility. It'll have all the information that you see posted within this webinar. I also want to remind you, just in case you're a new provider or maybe not currently getting our provider alerts are our official way to correspond with providers that are enrolled in Medicaid. Whenever you filled out your application to become a Medicaid provider, if you provided an email address, you should be receiving provider alerts electronically through that email. If not, you'll want to get in touch with the provider assistance line with Gainwell and ask that you have your email address added so you can receive those alerts. We have put out the alert also on the website. It's posted under same website, medicaid.alabama.gov, and you go to the first tab, which is Newsroom, and then you select Alerts from the drop-down menu, and all of these alerts are posted there. You're going to see some more information, I think, about hysterectomy forms and the other information discussed today. You'll see some more specific alerts coming out. We just wanted to do this preliminary webinar so that you could have the information initially and give you a chance to ask questions. So also, I'd like to put a plug out there too, that we do have a Facebook page for the agency. We've recently added LinkedIn. LinkedIn is the social media that we'd like to start using for communicating with our providers. So if you're not already connected to us, please look out for our LinkedIn page. It's just Alabama Medicaid Agency on LinkedIn. And we're going to start putting some specific provider information on LinkedIn about webinars, educational opportunities, training, anything that providers need to be aware of. And that would include this coming weekend. We have a system maintenance outage. This is to do some much needed maintenance on the current provider portal. So it will be unavailable from 5 p.m. on Friday, this Friday, possibly until Monday, but we hope it's just going to be a less than 24-hour event. But you'll see that messaging on an alert out there now. Also, you'll see the link to that webinar in the chat. So if you go to our chat right now and click on that link, it'll take you to that. I will also be putting an alert out and posting it to the website under the alerts once the system is back up and running. We hope that's going to occur on Saturday, but just in case, you never know how updates are going to go with our system. So it could take a little bit longer than anticipated. So hopefully you can have some patience with the agency as we do this much needed maintenance and realize that we'll have it back up and running just as soon as possible. So thank you for your time today and your attention, and we hope you have a great afternoon.